When I turned 18, I decided that I was going to go into law enforcement as my career path. A couple of problems got in the way. First, you have to be 21 years old. And second, you have to pass a vision test, or at least you did then. And let's just say I failed the eye exam more than once. So life took me in a different direction. I decided to go to nursing school. That's a TED Talk for another day. And I started working in the emergency room. And it was there I began caring for patients who were impacted by violence. And when I'm speaking of patients impacted by violence, I'd like to share a few statistics with you. First, 1 in 4 women and 1 in 10 men will experience intimate partner violence in their lifetime. Half of the women will have some type of sexual violence in their life. 600,000 children are abused each year in the United States. And if you're strangled once, research shows that you are 750 times more likely to be killed by the abuser. Now, these statistics are not just numbers. These are our family and our friends, and maybe some of you even here this evening. These patients came to the emergency department looking for help. And it was help that we had not been trained to provide. Imagine getting a shot from someone who had never been trained to give a shot before, and they had to read the instructions before they did it. It wouldn't instill a lot of confidence. Patients who are impacted by violence have very special physical and emotional needs. One of the biggest injustices these patients faced was our lack of understanding of their emotional needs. Patients who were victims of violence, especially those who were sexually assaulted, would come to the emergency room and they would be placed at the bottom of the list to receive treatment because often they didn't have obvious physical injuries. And so patients who had what appeared to be more serious medical conditions were taken first, while these patients were told not to eat, drink, or even go to the bathroom while they waited. They were placed in a crowded, noisy waiting room, sometimes all alone, and they waited there for hours. They had trauma, but it was an invisible trauma. Consider this. After the most awful day of your life, the most violent, traumatizing day of your life, you go to a healthcare system to seek care. And the healthcare system traumatizes you more than the assault itself. That's what patients told us. Patients told us that coming to the hospital after this event was more traumatic than the event itself. This was a hard pill to swallow, but it was true. Another area that we failed our patients in was we had a lack of training in the forensic components, in the evidence collection. Evidence collection is critical in these cases. Evidence can link a person to another person or to a place. This is known as Locard's principle. Every contact leaves a trace. Just imagine the amount of trace evidence we've all left here during these talks this evening. This lack of evidence became really evident in the criminal cases as healthcare providers were rarely called to testify as expert witnesses in court. As a nurse, I really gravitated to caring for patients that had been impacted by violence. They were vulnerable. They needed my help. And to be honest with you, nobody else wanted to take care of them. So one day, while I was in the break room, I saw a flyer that said there was a week-long training for nurses, and it would teach the nurse how to take care of patients who'd been sexually assaulted. I went to the training and I learned how to collect evidence and identify injuries and testify as an expert witness in court. I was learning to become a forensic nurse before that was even a thing. I want to share a couple of definitions with you. Forensics. The term forensics means scientific techniques in crime detection. A forensic nurse is a registered nurse who has specialized training in the care of patients who've been impacted by violence, where the healthcare and the legal system intersect. Forensic nurses take care of patients of all ages. We take care of patients who've been victims of sexual assault, domestic violence, human trafficking, strangulation, elder abuse, workplace violence. Sadly, last year, our program took care of children, and it totaled about 30% of our total patient volume. Now, there's a couple of misunderstandings that I would like to share with you about forensic nursing. When I tell people I'm a forensic nurse, sometimes they'll say, "Oh, you take care of dead people." Actually, when they come to the hospital, they're alive. The other one is that people think that I'm a law enforcement or police officer. I'm a nurse, first and foremost. And these cases are not finished and taken care of in 60 minutes like the crime dramas on TV. Forensic nursing really is a calling. These patients trust me to take care of them on what could be the most difficult day of their life. And this is not a responsibility that I take lightly. Now, let's fast forward to today. I am highly privileged to have a team of 30 forensic nurses, victim service advocates who are social workers, and community health workers who focus on violence in the community. Our program sees over 3,400 patients a year, and we have a forensic nurse on duty 24 hours a day, 7 days a week to provide comprehensive medical forensic care to these patients who are so much in need. This team approach allows us to provide care that's trauma-informed. It's about the patient's choice of how they would like to receive care. We give our patients a voice and a choice, and we give them back control in a situation where they've lost control. The exams are conducted in a private area where they feel safe and comfortable, and patients are provided with their options. For some patients, they only want medical care. Others want help reporting the crime, and a lot of our patients really don't know what their next step should be. And that's where our advocates and community health workers come in and are critical. They help our patients with the emotional support that they need, not only while they're in the hospital, but also after they leave. They also provide resources, and they provide shelter and counseling, and they provide food. Now, the program I just described to you is very unique. Unfortunately, there are very few programs in Virginia and across the country like the one I just described. In fact, there are 143 hospitals in Virginia, and there are only 20 forensic nursing programs in the state. And some of them are struggling to have a forensic nurse available. There are patients who travel 1 to 2 hours just to find a forensic nurse to take care of them. And in many hospitals, they have healthcare staff who are still untrained to take care of patients who've been victims of violence. Now, I think patients deserve better than this. I think our patients deserve to have a comprehensive medical forensic exam by a forensic nurse, an advocate, and community health provider who are knowledgeable and supportive of their needs and will help them on their road to healing. Thank you.